Welcome to the Home Education with Ease podcast. I'm your host, Christine Furman, a homeschool mom, entrepreneur, and educator with over 20 years of experience in the areas of elementary and special education. It's my mission to help you create lifelong learners and embrace a holistic approach to education at home. I'll be sharing practical strategies, inspiration, and resources to support your family. Whether you're a stay-at-home mom, a business owner, or balancing work and homeschool, you're in the right place to connect with a community that values education just as much as you do. Join us each week as we ditch the stress, embrace the joy of learning, and set your family up for a lifetime of success. Hello, friend. Welcome back to the Home Education with Ease podcast. I'm your host, Christine Furman, your home education expert. Today, I have a very special guest to introduce to you today, Dr. Leslie Pasco, the founder and CEO of MyoWay Centers for Kids. As a general dentist for over 25 years, a consultant, and a professional speaker to the healthcare industry, Dr. Leslie has experienced the dental profession in almost every way. In treating hundreds of thousands of patients over her career and observing a serious health pandemic afflicting our population, Dr. Leslie is also trained an orofacial myologist and certified Buteyko breathing instructor, is now dedicated to the remaining years of her career to provide myofunctional therapy options to help children grow and develop their jaws and airways properly so they can breathe right and live a better for a lifetime. So friends, I'm so excited to have Dr. Leslie as a guest today. We were co-authors on our latest anthology, Course Corrected. And once I heard more about what Dr. Leslie does, I knew she would be the perfect fit for the show. I am excited to learn right alongside you as Dr. Leslie discusses why sleep-related breathing disorder in children and adults is on the rise. What are the signs and symptoms of a child with those sleep-related breathing disorders? What can be done, and what happens if you wait too late? So without further ado, Dr. Leslie, thank you so much for being here today. Can you share a little bit more about yourself and why you're so passionate about sleep-related breathing disorders in children and adults?
First of all, Christine, thank you so much for having me, and I'm really looking forward to sharing this information. It's such critical and vital information for parents, healthcare providers, and educators, really anyone, to have. Mm-hmm. So the reason why I got involved in this, or the reason why I'm so passionate, and I retired out of clinical dentistry and dedicated the rest of my career to orofacial myology and helping children's jaws and airways develop properly, is because in the nearly 30 years that I practiced dentistry, I was able to see the increasing problems with people's medical histories. So when I got out of dental school and I would look at a medical history for one of my patients, it might take me, a minute or so. I look through, it was very easy to follow. Oh, yes, understood. Move on, let's get the dentistry done. But towards the end of my career, it could take me 10 or 15 minutes to go through a patient's medical history and try to understand what was going on. And so basically what was happening is people, our population, they were getting sicker and sicker and sicker. And when I started to dive into the reasons why that is happening, there were lots of different answers that I found, but the one answer that I found that could be easily prevented was how a child grows and develops their jaws and airways and how they breathe. And so that's why I decided to sell my dental practice, retire out of dentistry. And I have to tell you, Christine, and I think the book says it too, I really teetered for a while there. I really thought about just sailing off into the sunset and going on vacations with my husband and eating bonbons and baking cookies, I really thought about that really hard, but I felt that it would be wrong to have this information and not do something about it and do something with the information that I have.
Mm-hmm. I love that. And I just refreshed myself on your chapter yesterday. So I read that last evening. So guys, if you have not checked out Course Corrected, this is just a quick little plug for our book that we wrote together. You can hear more about her story, Dr. Leslie's story, because that was so fascinating to me. Like, you were ready to retire. You were ready to say, you know what? I put my time in. I worked. I built a successful dentistry practice, and I'm ready to sell it and just retire and be done. And then you're like, nope, I'm going to start a new business. So I love that for so many reasons, because one, I feel like when we're on this earth and we have a calling and we know what God's purpose is for our life, like, we know we're not done. And we know, like, okay, we need to step into this purpose and we need to fulfill it. And I love that that's the path that you took. And now you were able to help so many more families by doing this. So I'm excited.
Thank you, Christine. Yeah, me too. It's a path that hasn't really been traveled very much. There's not a lot of oral-facial myologists providing myofunctional therapy in the way that we're doing it, especially for jaw and airway development. So, it's sort of like I'm pioneering it more or less. And it's very rewarding.
And I love that, because I was talking to one of my clients, and she was talking about this. She was talking about, I'm going to go to this specific doctor that was further away from her house, an hour or so away, and find this doctor that is going to help my child with breathing and airway and all of these. And I was like, what? Like, tell me more about this, because it was so new to me. I feel like my eyes have been opened a lot in the past 5 years, especially. And that was definitely something that I was like, oh my gosh, I want to know more about this. So whenever we met, I was like, oh, this is perfect, because if I don't know about this, how many other families do not know about this, and how it could be affecting our children's behavior, how it's affecting their sleep. We homeschool, so my kids are able to sleep in and get as much rest as they need, but that's not typical for children that are in school. And then they have so many problems. I mean, I was in the classroom and I've seen some of those problems, and I've seen, they have this, when really maybe there's something even deeper. And I think that's really what you are getting to, right? There's a deeper cause to a lot of this. And I would just love to dive into more of that with you. So what does this even mean? Like, their airways, and what are some of the benefits that you have seen?
Yeah, absolutely. Well, I think starting first with just the history, and why are we seeing so much of this, and why is your friend, or was your friend, looking for someone to help her? 10,000 years ago, human beings didn't have this problem. 10,000 years ago, if we were sleeping as a family in a cave and someone in our family was snoring, that would be a liability.
Right, right.
And so our bodies are not designed to be loud or make any noise when we're breathing or sleeping. And the anthropological studies show this, because if you take a skull from 5,000 years ago and you look at that skull, you can see that skull is bigger and denser. The jaws are bigger and denser, and all 32 teeth, yes, including the wisdom teeth, fit perfectly into that human being's jaw. They have a movie star smile way before the movies were ever invented. And that's because we were living the way our bodies were designed to live, more naturally. Mm-hmm. And we were hunting and gathering our food. We were walking 25, 30, 50 miles while chewing on a piece of bamboo all day to find our next meal or to find our next safe shelter. We got all the exercise to develop our bodies the way our bodies were meant to develop. But today, we just drive down the road to Chick-fil-A.
Right,
right. It's a smoothie joint, and we just gulp down, some food, and, we don't chew it, basically. And so our jaw muscles are not getting that exercise. And it's those jaw muscles that determine how our jaws grow, and then consequently our airways. If the jaw muscles are working the way that they're supposed to, just like any other muscle in the body, the bones grow and develop the way they were intended to.
Wow.
Yeah, so basically what's been happening over centuries, rapidly, since the Industrial Revolution, and food became very easily accessible and mass-produced and soft and processed baby foods, things like that, is our jaws are shrinking and shrinking and shrinking. And that's what's been going on. And our jaws don't have enough room for our tongue and the rest of the muscles that are attached to that tongue that's attached so deeply down that we become our own breathing obstruction. And this is why sleep apnea is on the rise. And this is also why, Christine, hyperactivity issues in children are on the rise, because children are developing into their own breathing obstructions, and they're not breathing at night or during the day the way that they were intended to. So their brains aren't developing the way they were designed to develop either.
Wow.
Yeah,
So
right?
crazy. I mean, there's so many things that I'm taking in as we are just talking, and it's like, yes, I 100% agree. Like the foods, and we are now going back to some of that baby-led weaning of giving them food, but it's like, yes, why were we not doing that all along, right? Why did we crush up all of their food? And I even think of myself, right? We drink smoothies, or I'm giving my kids smoothies. I'm like, oh my gosh, are we practicing our jaw muscles enough, So, this is so, so good. So, okay, so let's talk more about that then. How is this causing those inactivities then? How is it causing that sleep deprivation for our kids? They're not getting enough sleep, and then it's causing these behavior issues.
Yeah, that's a really good question, and the answer is mind-blowing as well. Most people don't think about this, and so it's not unusual as I have these conversations with people for the light bulbs to be going off, and then, it's like a whole new revelation. So what's happening then is the reason why children are having issues with their behavior, and that is on the rise, and issues with focusing and attention and hyperactivity is because children are mouth breathing over nasal breathing. And mouth breathing is the backup breathing system for the human body. If we go back to our hunter-gatherer days, we were only mouth breathing when we were being chased or threatened.
Wow.
And so our body is designed to understand that when we mouth breathe, we're in danger.
That fight, flight, or right? Freeze? Yeah. Like, is that kind of putting us into that? Wow.
That's exactly what it is. And so when we mouth breathe, our brain turns on our fight or flight response system, or our sympathetic nervous system. When our brain does that, it turns off everything that we don't need for short-term survival, right? It turns off everything we need for long-term survival, and it turns on everything we need for short-term survival. So it turns on the blood flow to our extremities. So our arms and our legs can move real fast. Does that sound familiar? You were in a classroom, right?
Right. Exactly.
And then it turns off our digestion. It turns off our cognitive function, because we don't need to think to run away from a bear. We just need to run.
Right?
We don't need to digest our food. We'll save that for later. Right now, we just need to use what's on reserve and get away. Okay? So our bodies were designed to use our mouth cavity for breathing only when we're in danger. So if a little boy or girl is breathing through the mouth, day or night or both, for whatever reason, because they're obstructed in their nasal cavity, or because it's a habit, or both, the brain doesn't understand that that child is safe. The brain believes that the child is in danger, and the brain turns on everything that that child needs for short-term survival. Long-term survival is out the window. And so as they're growing and developing the short-term survival part of the brain, the amygdala, the animal instinct part of the brain, the reactionary part of the brain, the quick reflex part of the brain.
Right.
They're not focused on developing, or the body isn't focused on developing the prefrontal cortex, which is that linear thinking, rational decision-making, long-term survival processes. And so that's why we're seeing so many of these children with these issues today. I believe. And the medical research supports that as well.
Oh man, this is so fascinating. And this is, let me just say, maybe we're saying most cases that we're seeing, right? So there could be exceptions to this, correct? Sure. So there could be learning disabilities that maybe are not affected, but we're talking more of that active, kind of behaviors, that impulsive kind of behaviors, correct?
Yes. And you had asked me, like, what kind of results do we see, or, how does, in the center here, we have children that come in for their first appointment that, unfortunately are not well behaved. They're unruly. I've seen them hitting their parents, punching walls, throwing themselves on the floor. We correct their breathing pattern using the Buteyko methods. We increase their capacity for their tongue and their muscle structure in their oral cavity so everything can sit right. We increase the ability for them to breathe through their nose, and we see those behaviors change.
Wow.
And parents tell us it's like night and day. Teachers tell parents, what happened to your kid? Because something has changed. That. And it's because the child is breathing properly. They're growing and developing properly, so their brain is functioning the way God intended for it to function.
Mm-hmm. Wow. Yeah.
So we see those changes, and there's scientific research paper after scientific research paper that admits that maybe there's a lot of children out there that are on these medications that maybe should have been evaluated for sleep-related breathing disorders first.
I've said that for many years, that it's very easy to say, oh, they are ADHD and let's just put them on medication. And I don't always agree with that. I feel like there are other alternatives that we need to check out first. And I now obviously know that this will be one that I recommend first, Yeah,
and you bring up a good point, Christine. It's those medications that they get put on too. And, those medications actually stimulate the sympathetic nervous system response. So now we're treating a sympathetic nervous system response issue with a stimulant for the sympathetic. So
it's just building. It's just building on top of it.
To build, yeah.
Yes. Yeah. Yes. So whenever you are treating the children, is it more of a therapy where you're working on breathing and moving your muscles correctly? Is there any kind of surgery that is done, or is it, can you share that method, process?
I would love to. Yeah. So all of our therapy is non-invasive and can do no harm. We use myofunctional therapy appliances, both passive and active, to passively retrain and build the muscle function, as well as actively retrain and build the muscle function. In that process, the muscles actually grow and develop the jaws and the airway properly.
Wow.
And the children grow and develop better, they breathe better, and they're living better. We pair that with standard breathing, Buteyko breathing exercises. We monitor the progress. We measure their breathing function as they progress throughout the program. And towards the end of their program, when they're getting close to graduating and getting into the maintenance phase, we continue to monitor every 6 to 12 months or so, just to make sure everything's still going in the right direction.
Right. Just continuing that they're practicing those skills that they have learned, correct?
That's correct, yeah. And you can imagine, you work with children, Christine, so you know how difficult that could be to coordinate oral exercises with a 2 or 3 year old.
Right.
How could that be done? We use, oral exercising appliances, that passive and
looks like a retainer. For those of you that are listening on a podcast, Dr. Leslie has a couple. They just look like retainers. And you would put those in. And I do think my client was actually using that for her son, something like that he would wear that for, how long would they wear something like that for?
Yeah, so depending on their age, 2 or 3 years old, we're happy to get a couple minutes. And a couple minutes goes a long way in a younger kid because, the maximum oral facial growth happens in the first 2 years of life. Wow. And by the age of 6, 60% of a child's face is fully developed. So even just, technically we'd like to see twice a day, 10 to 15 minutes. But if they can get even just a few minutes in at a younger age, it goes a really long way. And it makes dramatic positive effects in a very short period of time.
Wow.
The passive appliances, depending on their age, could be worn for 10 to 15 minutes a day, twice a day. And as they get older, the passive appliances could also be worn at night when they're sleeping.
Okay. So I guess that brings me to a couple more questions. One, could this be, let me ask you this question first. You said up to 6 years old, that's pretty much when their faces are pretty much developed, but you also treat all the way up till adults. So how does that, after that development has already happened, how are we then correcting that behavior or that growth that has already been developed incorrectly, right?
Correct. Yes. 60% is done forming of the child's face is done forming by the age of 6, but there's still another 40% there. Girls are usually continuing to grow and develop until 17 or 18, and boys until they're about 22 years old.
Wow.
So we still have a lot of positive influence. So we can get those muscles functioning properly so their tongue is up into the right position, resting on the roof of their mouth instead of in the back of their throat, so that they grow up with a nice toned, firm, properly positioned tongue. In adults, when we work with adults, they're usually adults who are referred to us by a sleep center or a dental sleep center, or they're the parents of our children on the programs, or they find us somehow, through the Buteco connection. But with adults, and I've treated myself with this, and I've treated lots of my friends and family members too, exercising those muscles, tones, all of the muscles that are associated with good breathing function. And the tongue is one of those, but also your air tube right behind your tongue, that oral pharynx area, that all can be toned and strengthened and broadened so that you can breathe better as well. Now, what happens if a child isn't growing properly, their jaw is too small, their upper arch is too far over their lower jaw, or and they go into adulthood that way? Well, then surgery is something that a lot of orthodontists will look at to actually break the jaws and reposition them, coinciding with braces, to get a good function. That's pretty aggressive. It's called orthognathic surgery. It's a tough surgery to go through. I had considered it even myself as a victim of the small jaw epidemic myself. And I'm glad I didn't do it because the exercises provided me with what I needed. But that's one of the potential corrections. There's other surgeries to bring the tongue forward. There's surgeries to remove other parts to make it easier to breathe. There's lots of different surgical options, but as we know, surgery, should be the last choice.
I agree. I think that's great. So these are some of the things that you guys do at your practice. Is this something that you guys are in Wexford, PA? Do you only treat patients at your center, or can you work with people virtually?
We work with people virtually and in person, or a combination.
I love that.
So we have a lot of local clients that do some of their visits with teletherapy. And then we have clients all over the country, and we even have them out of the country.
Wow.
Some of them that we're helping as well. So yeah,
that is amazing.
Thank you. Yeah, it grew faster than I thought.
So when did you start?
We started about a year and a half ago. It was May of 2024. I retired in August of 2023, and I toyed around with the idea of just retiring, and then I don't want to spoil what's in the book there, but as I was in an orthodontist office for my daughter's orthodontist visit, two mothers started talking. One of the mother's children was slated for that orthognathic advanced jaw surgery to correct his dental issues, which I'm sure the kid had breathing issues as well then. And the other mother said, oh, wait. Before you do that, you should look into myofunctional therapy. Wow. And I had been sitting there, I was on my computer, I was doing some research, I was going back and forth, should I, shouldn't I, shouldn't. So I threw down my pen and I said, okay, I'll do it.
Right. I mean, just what a sign that is right there.
Yeah.
I mean, how amazing
Yeah,
I love that story. When I read that, I was like, oh, I just love that so much, because sometimes we just are looking for that confirmation, like which path is the right path. And when we hear those signs, I literally have chills right now, because it's like, oh, all right, I know what I need to be doing. This is the path. So in your practice, in a little over a year now, how many patients have you been able to help, just roughly, with what you have been doing?
Oh my gosh, hundreds.
I love that.
Hundreds, yeah. And those are just the children that I'm thinking of. I don't really have a number on the adults, the parents that come along with the program, but just to give you, we have a little booklet of all the different successes that we've had. Parents are noticing improvements in their kids' facial structure, closed mouth posture, sleeping with their mouth closed. One parent reported that their child hadn't slept through the night for the first 3 years of never. Can you imagine that?
No.
Having to wake up every night with would wake up, come into the bed or have night terrors. Within a month after starting the program, he slept through the night and has been sleeping through the night ever since.
Oh, that's so amazing.
Yeah. Less congestion, getting off congestion medication, quieter breathing. One teacher here reported that the mom said that the teacher said the lights turned on for their child at school. She noticed that his behavior improved. Before, he used to just do things before asking, like climb on the kitchen island. Then he got to a point just within a few months of starting our program where he would look at the island, he would look at his mother, he'd look at the island, and the mother would just look at him, and he wouldn't climb on the island.
I love
whereas
that.
Before it would be an argument,
Right.
Just wonderful stories like that. And then I get asked a lot because I deal with a lot of medical providers are like, well, what measurements do you have, or what scientific reports can you show me on these kids' results? Do they do sleep studies? Are they getting MRIs? Are they? Sure, we could go down those roads, and we could put these little ones, 3-4 years old, through inconclusive sleep studies, and we can put them through unnecessary radiation. But these stories that my parents tell me, they're enough for me. As a medical provider, that's enough. That's all I need.
Absolutely. And I think as a mom too, the least invasive, like I don't want to put my child through an MRI. I don't want them to do a sleep study. If I can hear these testimonies over and over and over again that parents are seeing the change, the transformation, like that is enough,
Exactly. There's children, many of our children go from grade 3 tonsil size, which is obstructing their airway, and they're on the verge of getting a tonsillectomy, which can be a dangerous procedure for young children. It's a very vascular environment, to coming down to a grade 2 or 1 without obstructing and they're breathing and they don't need the tonsillectomy. I'm not saying that's always the case, because if it is truly an obstruction that's preventing us from training a child to breathe through their nose, then yes, that needs to be addressed. And we always work with ENTs and orthodontists, to complement what we do. But there's a lot of cases where these children may have had that surgery that maybe didn't need it.
I love that. I don't love that children are either having surgery that they don't need it, and or getting on medication that may not need it, when there could be more of that root cause. And that is really my mission too, is like, let's get to the root cause. Always ask the why questions, as we are talking health wise, or with our children when they are learning. Why aren't they able to learn, or why aren't they able to pick up this skill quickly and easily? Is it something that they need addressed medically? In this case, breathing and sleeping. Is it because they just don't understand it the way that it's presented to them? So I'm very much like, let's get to the root cause of it. Let's figure out that why factor. And I have a little bit of a selfish question here, question personally for myself, but like my children are 8 and 10, and they're getting into that. We've had the braces consultation, right? What are your suggestions, or, what's your thoughts on that? Are braces necessary, or is that something that are we too far past to do the therapy that they would probably still end up in braces?
So I'm a big fan of what orthodontists provide, and traditionally way back when, over 100 years ago, when orthodontics was started, it was started as muscle therapy. And there is documentation from the founder of orthodontics documenting that it's the muscle structure that determines the positioning of the teeth. Now, that said, if we were all living like we were supposed to, 4, 5, 10,000 years ago, sure, we wouldn't need braces. That's not going to happen today. And I'm certainly not going to, Christine, go and live in a cave and hunt my own food anymore. Like, it's not happening. So we need to do things like orthodontics, and we need to go to the gym to exercise to supplement the way that we're living our life now. That said, we complement orthodontics. We help orthodontic treatments move better, maybe even faster.
That makes sense.
Quicker, easier results, which is good for a child's self-confidence during those critical years, so that they're not in braces for 5 years or so. And then also getting that result that orthodontist gets to last, because if sure, kids wear retainers and it helps, but it's those muscles. If the tongue's not positioned properly, if the chin is overactive, the cheeks are overactive, the swallow isn't correct, the breathing isn't right, then of course everything goes beyond just straight teeth, but those teeth get crooked again.
Absolutely.
Or they start to relapse. And how many adults do you know?
I'm one of them that just finished up the Invisalign treatment because my teeth went exactly back the way they were before I had, not exactly, let's just say that, but I could see the shift. Yeah. And I was like, you know what? I am now not as confident, because I can see that in pictures, or I can see that in my videos, and what do I need to do? So I'm loving this. Even for myself, I'm like, oh, maybe I need to sign up for myself, because we want to make sure we're the best that we can be for as long as we can be. I don't want to end up in having sleep issues later on in life, or how can I help my husband? Or are there family members that could benefit from this? My children, my daughter, she has dealt with night terrors forever, and they have decreased significantly, but I tried everything, every possible, the sound, the oils, the this, the that, the teas, all the things that I could think to help to calm her so she can sleep peacefully. But I never thought of this. And this just makes so much sense then,
Yeah, we've had child after child with night terrors, they go away. You got to remember, it's that sympathetic nervous system response. They're in danger mode. Everything's frightening.
Yeah.
And you're running.
Yes.
So, this is a good place to start. And I would say for your children, Christine, we're happy to see your children and do an evaluation. In the entire year and a half or so that we've been at the center, more than 90% of children have these issues. I've come across one family where the children were growing and developing ideally.
Wow.
One family that I can think of, ideally. Yeah.
That is crazy.
So there's a lot of children that need help. There's a lot of children that, the interception, the early intervention, it can be done. It should be done. It should be the place that pediatricians are starting.
Yes.
When they're talking to their patients. Dentists in 2018 were tasked with the job of screening every single patient for sleep-related breathing disorders. It's still not happening.
Wow.
It's something that has to be done, and it's good for the child's development, but it's good for them as they continue to grow and become adults and age.
I love this all so much. So let's share with our listeners how they can get connected with you, because I know my family and we're going to be coming to see you in person because we visit Pittsburgh multiple times a year. So we're coming to see you in person and then continuing virtually, but how can families nationwide, even worldwide, be able to get in contact with you?
Sure. Visit our website at myofunctional.com. We have a Facebook page. You can look us up there. We're on Instagram. I'm on LinkedIn. Healthcare providers can reach out to me directly through my LinkedIn page. I do provide educational webinars and seminars and lectures with CE credits attached for if you're a healthcare provider and you're listening to this. Those would be the best ways. Right
That's
on
great.
our website, there's a free consultation booking link. You can book a consultation as early as the next day, probably.
Wow.
Yeah, we make ourselves very available because no child or person should have to wait.
That's right. I love that. So all of these links are going to be in the show notes below, so you guys can get in contact with Dr. Leslie and be able to reach out as soon as today and be able to, see if this would be a benefit for your children. And I have a very big suspicion that it would be a huge benefit for most children. So I am so grateful that we connected and that we are able to continue to spread this message to so many more families. And I'm not going to stop. I'm the person that once I learn something and I'm like, listen, guys, you got to try this first. So I'm going to keep spreading this message. And I'm just so grateful that you listened to God's, little inclination there and said, your work's not done. There's still so many people that need your help. And I'm going to cry because to me, that is just so beautiful.
Well, thank you.
Yes.
It's okay to cry. It's a good emotion.
It is. It's so
at the right time. Correct. Yeah,
That's
absolutely.
right.
Yeah, it's a touching subject. I mean, we're talking about children. And Christine, I thank you because it takes people like you who are awake enough and paying attention enough to share messages like this. And it could potentially save a child's life, as you saw in the Connor Deegan video.
Yes, and we're going to share that in the comments here. So Dr. Leslie shared with me, guys, I'm literally tearing up. If you're just listening to me, I literally have tears in my eyes, okay? So I'm going to pull it together here. But Dr. Leslie shared with me a video about Connor and it's a YouTube video. It's a 5-minute video, and I watched it, and it's going to be in the show notes as well, but it's about his story of how he was struggling. He was, getting D's and E's in school and went through the therapies and did the work and then became an A and B student. So definitely check out that video because I was like, oh my gosh, like eye-opening. And I work with so many children, so eye-opening for sure.
Yeah, and that's one you want to have a box of tissues for because I actually tried to include those videos in my presentations, but I couldn't because every single time I watch it, Christine, I cry.
Yeah.
Like a baby. So,
yes.
It's a beautiful story because the parents were kind of at their wits' end. They were ready to give up on Connor, and all it was is he wasn't breathing right, and it was an orthodontist who noticed that his palate was too high and put him through the orthodontic therapy, the myofunctional therapy paired together, and it completely changed his life.
Wow. I love that. Yes, it definitely is. And you now have those success stories as well. So that's so beautiful. Any final things to share with our listeners?
I would just like to leave the listeners with this, trust your mommy gut or your daddy gut. If you know something's wrong or something isn't right and your pediatrician or your medical team isn't giving you the answer that you feel is correct, dig further and find the answers. There's so much information out there that it's all there. It's all there. And just the littlest sign or symptom, I've had parents tell me, oh, well, they don't snore a lot, it's just a little bit. Well, it's still a sleep-related breathing disorder. It can still impair their function. It's still something that should be evaluated, even just the littlest thing. If you're suspicious, get it looked into.
Definitely. I totally agree with that. Just lean in. That's a big thing too, for us is like leaning into that intuition for sure. So, well, thank you so very much for being on the show today. I am just so excited to have you here. I learned so much, and listeners, I hope that you learned just as much with me. So definitely reach out to Dr. Leslie for any additional questions or to get connected. All of these links are going to be in the show notes below. And I also want to invite you to the Home Education with Ease Facebook group and share your biggest takeaway from today's episode or your own personal story. I would love to hear those as well. I just want you to remember that you are not alone, and we are here to support and encourage you every step of the way. Thanks, Dr. Leslie, so very much.
Oh, you're so welcome.
Thank you for tuning in to the Home Education with Ease podcast. I hope today's episode left you feeling empowered and ready to take the next steps on your home education journey. Your support means the world to me. Please subscribe, leave a review, and share with a friend. For even more resources, be sure to join the free Facebook group, Home Education with Ease, and visit eduplaylearning.com to explore programs and subscription kits. You can find the links and any other links mentioned in this episode in the show notes below. Remember, you're not alone. This community is here to support you every step of the way.